Hello there, you must be my cranial nerve. Okay, fantastic. Well, it's lovely to meet you. I'm going to put on some gloves here and then we can begin, alright? Get yourself nice and relaxed. It's going to be a nice, easy and relaxing exam, okay? I won't be asking anything difficult, so everything will be fine, I'm sure. Okay, I'm Dr. Sean, by the way, so it's lovely to meet you. I'm going to be kicking it off with asking you a question, if that's okay. Alright. Have you experienced any changes in smell recently? So every so often I will be taking notes just on what we've been discussing or the results of the testing that we're doing, okay? But I'm not going to be writing down anything that I haven't already told you, so not to worry about anything like that. Okay. Alright. Putting these gloves on doesn't get any easier, I tell you. There we go. Kind of. Okay, there we go. Alright, so no changes in smell, that's fine. Alright, I'm going to be taking a look at your optic nerve, okay, which is just a posh way of saying your eyes. Alright, so what I want you to do is just look forward for me. Okay. I'm just going to be taking a look at both eyes. Just looking for anything out of the ordinary. Everything looks fine. Don't worry, okay? Just a routine check. Okay, yeah, everything's fine. Okay. A quick note here. Alright. Now I'll be having a look here at this wonderful eye chart. Okay, we call this the Snellen chart, but for all intents and purposes, it's an eye chart, alright? So what I'm going to be doing in a moment is I'm going to take a step back next to the back wall here, which is totally not a piece of fabric. And I'll be asking you to read off some of the bigger letters, okay? So it is just letters, there's no numbers here. Ignoring the vision numbers on the side, of course. Alright, so first of all, I want you to tell me which colour you see here, this line here. Which colour is that? Okay, what colour do you see here? Okay, and which of the two colours, if any, is easier for you to see? Because it could be brighter, could appear just more easier to see. Okay, fine, fantastic. Right, I want you to cover over your left eye for me. Okay, so you can place your hand like so. Or if you're skilled enough, you can wink, whichever is more comfortable. Alright. So I'm going to take a step back here. I'll be pointing to some of the bigger letters, and I want you to tell me which letter that it is that I'm pointing to. Okay? If you're not entirely sure, just guess. Okay, I'll accept your best guess. Not everybody gets all these right, so don't worry if you get a few wrong. Okay? Alright. So, with the left eye closed first of all, okay, I want you to tell me the letter that I point to. Okay, if you can do that, I bet you can. Alright, here we go. Good. Okay. Fantastic. Alright, really well done. Now, I want you now to close over, you guessed it, your right eye. Okay, so keeping the right eye closed for me. We're going to do exactly the same again using the bigger letters. Alright, so keeping that right eye closed for me. Here we go. Brilliant, well done. Now we're going to take a step closer here. So arm length apart from here. There we go. And I want you to read off the letters in this middle section, okay? Now, again, if you're not entirely sure, just give it your best guess. They are smaller letters, so it may be a little bit tricky, okay? As before, I want you to close over your left eye first of all, and then we'll close over the right after. Okay, so with the left closed, I want you to tell me what letter that it is that I point to, okay? You tell me what letter this is. Okay, so keeping the left closed. Good. Good. Really well done. Alright, you did very well there, better than most people do. Okay, now, as before, I want you to close over the right eye for me. Okay, thank you. And again, just tell me what letter you see and what I point to. Okay, here we go. Okay, you're doing very well. Brilliant. Okay, really well done. So give yourself a nice rest and a pat on the back, be it an actual pat or a virtual pat. Okay, you did very well. Again, we're just going to be writing down the results, okay, so just how well you performed at the visual acuity test, okay, which is what we call the eye chart. Alright, so pupillary reflexes coming up now. Pupillary reflexes, so basically I'm going to be checking your what we call the direct and consensual responses, okay. So the pupils will dilate when a light has shone into it, okay, so the pupils get smaller, and a healthy set of eyes will both dilate at the same rate. So even if I shine a light in one, even though the other eye may not have a light shone into it, it will mimic the eye that does have the light shone into it and contract at the same speed and rate, okay. Size, I should say, speed and size. Okay, so I just I'll be placing my hand, I'm going to be placing my hand on your nose like so, just splitting the two eyes, okay. I'm going to be shining the light into one and then looking into that eye, and then shining the light into the same eye and then looking at the other eye, which sounds awfully complicated because I'm not very good at explaining things, but it's pretty simple. Okay, so yeah, just looking forward is fine. Okay, so if you don't mind, I'm going to be placing my gloved hand like that. Is that okay? Fantastic. Alright, here we go. So just looking forward. So that's the direct and the consensual. Direct, consensual, direct, consensual, direct, consensual. Fantastic. Okay, so just to be doubly sure, we do like to repeat the test. Okay, so I'm going to be placing this time my right hand on your nose and checking using my left hand. Okay, so we're starting on the other eye this time. Okay, there we go. So again, just looking forward is fine. Direct, consensual, direct, consensual, direct, consensual, direct, consensual. Fantastic. Well done. So no issues there. Everything is fine. Really, really good. Okay. And there won't be anything wrong throughout this exam, I'm sure. It's very rare that we do actually spot something, okay? So everything's going to be fine, trust me. Alright. So we're going to do the swinging light test now, which sounds about as complicated as it sounds. Does that make sense? Probably not. Anyway, I'm going to be literally swinging the light from one eye to the other. So all I need from you is just to look forward, really. Okay, so just checking again the way the pupils are responding to the light. Okay, here we go then. Just looking forward is fine. Doing really, really well. We'll be giving your eyes a rest soon enough, okay? So don't worry about that. Okay, everything is fine. Okay, almost there, alright. Okay, that's fine, and yeah, give yourself a nice rest of the eyes. Okay, so blink as many times as you want to now. Have a little shuffle about if you want to, just get yourself comfortable. Okay, so we're going to be doing the accommodation reflex, okay? Again, it's a very complicated name, but basically it's just a focus test, okay? Now I want you to pick a point behind me. It can be anywhere, as long as it's on the back wall, which is totally not a piece of fabric. Okay, so if I stand right here, facing you, just pick a spot or a point behind me and look at that for me. Okay, just keep looking at that point. I'm going to be turning the light on, but I want you to ignore the light, okay? So keep looking at that point you selected behind me, ignoring the light. Okay, that's great. And now I want you to look at the light for me, please. Both eyes looking at the light. Okay, doing really well, alright? Okay, now I want you to pick another point behind me. It could be the same point or a different one, it's not important. Okay, so look at that point you've selected behind me. Ignoring the light as I move it. Ignoring the light. Ignoring the light. Okay, now I want you to look at the light. Okay, I'm going to take a step forward here, or half a step. Okay, keep looking at the light. You're doing really well. Okay, and now again, if you can pick another point behind me. Ignoring the light again, okay, ignoring the light. Ignoring, ignoring, ignoring. Keep looking at the point behind me. And now finally looking back at the light for me, please. There we go, really well done. Okay, and relax, okay. Good. Another quick note here. Absolutely fantastically well done. Okay, that's good. Alright, so we're going to be checking your visual fields. Okay, so it's a bit of a complicated check, this one, but I want you to cover over your left eye for me. I'm going to be covering my right, and I'm going to be checking the four corners. Okay, so what I'm going to be doing now, as I cover my right eye, I'm going to be bringing my fingers, twitching my fingers into your field of vision. Okay, all I want from you is to tell me when you can see my fingers twitching. Okay, but you must look at my nose. Okay, well actually it's better to look into my eye that I don't cover. But if you can't do that, then it's fine to look at my nose, okay, whichever's more comfortable. Alright? Okay, so cover over your left eye for me. I'll cover my right. You tell me when you see my fingers. Okay, so looking either at my eye or my nose. Here we go. Okay. Good, we'll do the same two again, okay? Good. Really well done. We can do the same opposite side now, okay? So you can cover over your right for me. I'll cover my left. Again, look at my nose or my eye that is open. We'll do the same again. Here we go. Good. 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 Okay, that's fantastic. Yep. Really, really well done. Okay. So this is all these tests are the optic nerve. Okay, so cranial nerve 2. So there's an awful lot of checks with the eye. Yeah, once we get through this, there won't be so much to do with the eye. So do bear with me. Okay, we're almost through it. Okay. Alright, we're going to do a fundoscopy now, okay, which is split up into 3 different checks, okay, so we're going to be checking the eye. So, I'm going to be using a tool here. We call this the ophthalmoscope, okay, so it's, yeah, it's OPHTHALMOSCOPE. Yeah, it took me a while to learn the spelling on that one, but it is basically a device which allows me to look not only at the surface of your eyes, but also, believe it or not, the back of your eye. Okay, so checking for things like scarring and issues like that. Okay, don't worry, we don't expect to find anything. Okay, but we do check as a matter of course. Okay, so I'm going to be changing my setting here. There we go. Now I need to be shining the light in both eyes for approximately 2 seconds. Okay, so what I'll do then is I'll warn you when I'm about to do the light, okay? So we're going to start on your left side, alright? So now I'm going to be shining the light into your left eye. 3, 2, 1, now, and we're done. Okay, and I'm going to be shining a light into your right eye in 3, 2, 1 now, and we are done. Alright, well done. I'm going to be changing my setting here, just a slightly different check now. There we are. Okay, so same again, bright light to both eyes for 2 seconds. Okay, here we go then. So shine a bright light into your left eye in 3, 2, 1 now. Okay, fantastic. And shine the bright light into your right eye in 3, 2, 1 now. And there we go, that's fine. Right, I'm going to make a quick note here, and we'll move on to the third and final check for the so-called fundoscopy. Okay, it's not much fun really, is it? No. Alright, it's more fun for me than you. I imagine having the lights shine, yeah, pretty bright lights shine into the eyes. They're not my idea of fun. Alright, so let's see, nothing, no problems there, it's fine. Yep, alright. So one thing I didn't tell you is I will need to add some eye drops. These what we call mydriatic drops. Okay, and what they do is they just enable me to have a look at the back of the eye. Okay, so it won't hurt a bit, I promise you. Okay, I've done this many times before, no complaints. You trust me, don't you? Trust me. Alright, so all I need from you is just to ever so slightly just tilt your head back just a tiny bit. Okay, that's fine. There we go, it's fine. And there we are, fantastic. Okay, so I'm going to be just dimming my light a little bit, okay? So I'm going to be hitting the light. I'll be back in a minute, I promise. I won't be leaving you in the dark, okay? Alright. Okay, now we're nice and cozy. Let's see, what have I done here? It is. It's so dark I can't even find my tools. Yes. Okay, so I'm going to be changing my setting here. High setting. There we go. And again, I'm going to be shining a light into your eyes for 2 seconds. Okay. Alright. So once again, shining the bright light into your eye, into your left eye, I beg your pardon. In 3, 2, 1 now. And we are done, and shine the bright light into your right eye. Goodness me, you think I'd get this right after all this time, but still get me left and right mixed up, and I do apologise if I just shone a light directly into your eye just then. I'm sorry. Okay, I'll start again, okay? Shine a bright light into your right eye in 3, 2, 1 now. And we are done, well done. Okay, so that's it for all the optic nerve checks, okay, cranial nerve 2. So we're done there. Okay, did very well. Pop this light back on. There we go. Okay. So just a quick note or two here, okay. Alright, I need to ask you now if you've experienced any double vision recently. That's fine, right, we're going to be doing a follow the finger test, okay, it's very simple. I'm going to be splitting the test into sides, so your left and your right side, okay. So all I need from you is to keep your head in line with mine, as it is right now, it's fine, okay, and I need you to track the tips of my fingers. I was going to say look at my nose then, wasn't I? It's a very late shift tonight, so yeah. Okay, so approximately arm's length away from you, that's fine. Now I want you to track the tips of my fingers. We're going to start on your left side first, okay? And then we're going to go over to the right after, alright? Nice and simple, I promise. Okay, so keep your head still, that's the trick. Okay, and track the fingers, just using your eyes, keeping the head as still as you possibly can, tracking the tips of my fingers, okay? There we go. Really twisting my hand as well as I do this, okay? Let's okay. Doing really well, okay? Just keep tracking the fingers. It's really good. Okay, I'm going to speed up a little bit now and just go a little bit more random pattern wise. Still keeping to the H pattern that we've been doing, but we're going to be changing it up just a little bit, okay? And there we go, relax. Really good, okay. Now we're going to do the right side, okay? So I'm going to be using my left hand this time. Same again, keeping your head in line with mine, making sure your arms length away, that's fine. So again, tracking the tips of my fingers, okay? Here we go. Good. I'm going to be looking in both your eyes as you do this, okay? Just making sure that you have no difficulty tracking, okay? Okay, we're going to speed up a little bit now. More random patterns. Good, I'm going to go a little bit quicker than I did before. I just want to test you fully. Oh, you seem to be doing really well, so I'm basically trying to catch you out here. At this point, you know, you're so impressive that I'm trying to catch you out. You're too good for me, okay? Really well done. Alright, excellent. That's good. Did you experience any double vision during that test? Okay, that's fine. Alright, it's time for the trigeminal nerve now. Yes, the trigeminal nerve is a complicated name, but it just means facial sensations. Okay, so we've got a sharp object here, which is a pair of tweezers. They're not that sharp, don't worry. And we have a cotton bud Q-tip, cotton tipped applicator, whichever you want to call it. Now, I'm going to be stroking this across your face, okay, so 6 points on the face, and I just want you to tell me if you can feel it. I'll be very gentle, okay, I won't be gouging your face or anything like that, I promise. Okay, so just tell me if you can feel it, okay, here we go. Good. Okay. Well done. Other side. Okay. Here we go. Good. Okay. Fantastic. So you felt that fine, that's wonderful. Now I need to ask you, did it feel the same on both sides more or less, or did one side feel particularly sharp, for example, than the other? Oh, fantastic. Okay, so now we're going to be doing exactly the same again, albeit now using the soft object, okay? So once again, I want you to tell me when you can, or rather, if you can feel it, okay? So the same 6 spots across the face, alright? Here we go. Good. Okay. Okay. Great. Wonderful. Now, I've got an idea you know what I'm going to ask you now. Did it feel more or less the same on both sides? Yeah. Okay. Good. Okay, I'm going to be checking your jaw area now, okay? So I just want you to relax first of all. Okay, can you open your jaw for me? Keep it open. Okay, and close. Okay, and now open your jaw again. Okay, close. Okay, just open your jaw again. Not so much, just a little bit, that's fine. Okay, and relax, well done. Now, I'm going to be checking your jaw reflex, okay? So I'm going to get this big scary hammer out, but don't be too worried, okay? Yeah, it is pretty big, isn't it? But not to worry, okay? What I'm going to be doing in a moment is with your jaw relaxed, so not clenched shut and not wide open, just relaxed. I'm going to be placing my finger on your jaw like so, and I'm going to be tapping my finger with the hammer, okay? So, keep your jaw nice and relaxed, okay? And I'll put my finger on your jaw like so, okay? Just keep nice and relaxed. Okay, that's great. We'll do the same again, alright? So again, I'm placing my finger on your jaw. Keep nice and relaxed for me. And there we go. We can see all the jaw reflexes. That's all fantastic. You find that the patients or the clients' eyes light up when I pull up the big hammer. Yeah, it's a nervy moment for a lot of patients, but you know, we have to put them at ease. Yeah, you did well. Okay, you didn't look too scared, so you did better than most people. Okay. All right, we're going to be testing Cranial Nerve 7 now, which is a bunch of facial expressions. Okay, so I'm going to be asking you to pull some comical faces in the name of medical stuff. Okay. All right, if you could raise your eyebrows for me and keep it there. So keep it raised. There we go, and relax. And now I want you to close your eyes. I'm going to be trying to open them. Okay, I want you to resist. I want you to keep your eyes closed. I'm going to try and open them. I want you to keep them as closed as best you can. Okay. Okay, close your eyes for me. And resist, resist, resist. And well done. We can do it one more time. Okay, so close your eyes for me. Resist me opening them. Resist, resist, resist. Well done. Relax. Okay, now I want you to puff out your cheeks. Okay, so with air inside your cheeks, puff them out like so. Great. I'm going to be trying to squeeze them in. I want you to keep them inflated. Okay, so keep them puffed out. There we go. Good, and well done. We're going to do the same again. Okay, I did actually have someone vomit on me once when I was doing this, so yeah, it's yeah, got to be a bit careful. Okay, so puff out your cheeks for me. Don't let me squeeze them in. Resist, resist, and there we go. Well done. Actually, once I didn't tell the patient to relax, and they kept their cheeks puffed out for a good 2 or 3 minutes. Yeah, they wasn't best pleased with me, I can tell you. So do relax. Okay. Okay, if you can purse your lips as if you was doing a Zoolander expression. Yeah, is that your best blue steel? It's not bad. And again, please, purse the lips. And well done. Relax. And a big teethy grin, cheesy as you possibly can. The cheesier, the better. Okay, and keep it there. Keep it there. And keep it there. No, just kidding. Relax. Okay. Good. Have you noticed any changes in your taste recently? Okay. Just your fashion sense. Yeah. Okay. That's fine. All right. And have you noticed? Are you hearing sound louder than usual lately? Okay. Well, I'm going to have a quick inspection of your ears, if that's okay. Yep. All right. I'm going to be just prodding, pulling, and folding over various parts of the ear. All I need from you to tell me is if you experience any pain or discomfort at all. Okay? Okay. Here we go. So folding the ear over there. Okay. Okay, if I squeeze the ear there, does that feel okay? Okay, and if I rub on the ear there, does that feel okay? No pain. Fantastic. On the other side now. Okay, so folding the ear over like that. That's okay. Okay, let's squeeze the lobe there. Any pain? Okay, and if I rub here, does that feel okay? Okay, hold on. Just a quick check routine, you know, just to make sure everything's fine, which it is. Okay. So we're on to Cranial Nerve 8. So we're busting out the tuning fork. If you're not sure what a tuning fork is, I'm not very good at explaining it, so you're just going to have to continue to be bedazzled by it. Okay. So yet again we do have another hammer, but this time I won't be hitting your face with it. Okay. So this tuning fork will resonate at 528 Hz. Okay, so all that means is it's got a very high pitched sound like so. It is quite a pleasant sound, yep. Okay, so we're going to be doing 2 famous tests with the tuning fork. Okay, we call this the Rene and also the Weber test. Okay. So first of all, I'm going to be placing this tuning fork. Believe it or not, I'm going to be placing this on, yes, on your forehead. Okay, I'm going to place it in the centre of the forehead, and I want you to tell me, does it sound the same, roughly, from both ears? Okay. So we're looking for the sound to sound even across both ears. So we're just confirming that. Okay. So here we go. So on the forehead. Here we go. Okay, did it sound more or less the same through both ears? Okay, we're going to do it one more time just to make sure. Okay, here we go. Did it roughly sound the same? Okay, that's fine. Right, we'll be placing the tuning fork now in two different positions. Okay, one behind the ear like so, and one in front of the ear. Okay, so position 1, position 2, on the other side, position 1, position 2. Now I want you to tell me quite simply which is louder, position 1 or position 2. Can you do that for me? Okay, here we go. We're going to start with your left side. Okay, so this is position 1 to begin with. There we go. Okay, now position 2. Which was louder, position 1 or 2? Okay, do the same on the other side. Okay, position 1. And 2 is this. Okay, which was louder, 1 or 2? Okay, give me a quick note there then. That's good. Okay, then a quick look in your mouth, that's okay. If you can open your mouth wide, not too wide that it's uncomfortable, but wide enough so I can have a good look in there with the light. Okay, and if you can say ah for me. Ah. Good, keep saying ah. And relax, that's fine. Very quick note here. Okay, that's fine. Right, so now I want you to shrug your shoulders for me. Keep them there. And relax, it's fine. And now I want you, I'm going to place my hands on your shoulders, there we go. Now I want you to shrug your shoulders again. That's good. And now I'm going to try to push your shoulders down. I want you to keep them up by your ears, okay? So keep the shoulders up, resist, resist, resist. And there we go, well done. Nearly there. Okay, if you can open your mouth for me again. Okay, you can put your tongue into your left cheek for me. Okay, and now into the right. That's fantastic. Okay. Right, so that is that. We have come to the end of the test. Everything is fantastic. Okay, you've done really well. And you can book in at reception another test for about 12 months or so. Depending on the waiting times, it is up and down, so it's anyone's guess how long it will be. Alright, well, it was lovely to meet you, and have a nice rest of your day.